We're going to talk about flu season and flu shots. It's a thing you need to start thinking about now, and we'll have good advice on that from Dr. Christelle Ilboudo, who is from MU Healthcare, and she's been our guest before. It's good to see you again. How are you?
Good. How are you?
Doing well also. So you were telling me off the air that this is the week where maybe several places are going to start to issue flu shots?
Yes, we have flu shots available currently at MU Health in all of our pharmacies, all of our clinics. And so I think many other places are starting this week or early October.
What do you know about the flu season already? What are they anticipating this year?
We're anticipating to see the same viruses as we saw last year. So they've improved the vaccine to respond better to some of the influenza B that we saw. But essentially, the influenza A that we usually see earlier in the season will remain the same.
I don't remember how serious last year's flu season was as far as illnesses or deaths from flu compared to earlier years. What was last year like comparing it to previous years?
Last year, we had a higher incidence of complications and deaths, but we also had a lot of people who did not get the vaccine. So whether or not the season was due to a particularly hard strain or the vaccine is still hard to tell. But we did have more cases last year than we did the years prior.
That's interesting. I hadn't thought of that. You're right. Maybe some of these years where we see higher numbers, it might be because people did not take the time to get a flu shot. Are there studies, is there research showing why people don't get flu shots sometimes?
I think a lot of it is myths and misconceptions. Part of the reason the last 2 years people have not been getting the vaccine is that we did not have the flu mist available. And so for a lot of people, that became a deterrent to getting a shot because they couldn't get the nasal spray. And the other part of it is the myths about how it hurts or that the vaccine actually causes influenza, which it doesn't. So those are the reasons.
Those things seem to always be there, don't they?
Yes.
I mean, you hear that year after year. Oh, I got a flu shot and then I got sick. I mean,
Yes.
people regularly say that, but that isn't what causes their sickness.
No, that isn't. Oftentimes, people are already infected with the virus before they get the flu shot. And so the shot didn't have long enough time yet to work, and then they get sick is usually what happens.
Tell me about the mist this year. Is that available? Who should use that? Who shouldn't use that?
The mist is available for anybody who is not pregnant and can get it between ages 2 years and up is what's recommended. Actually, the pediatricians, the American Academy of Pediatrics is not recommending that as first line. And the reason is that we don't know how well the new flu mist will do this season. So it is used as a backup in case people are really needle phobic and do not want to get the shot. We would then offer the nasal spray.
I'll start it again. Why do we have to get a flu shot every year?
Because every year the virus changes, it mutates and it changes. And so last year's vaccine does not protect you against this year's viruses.
But there are some similarities expected between last year's viruses and this year's viruses, correct?
Yes, there are some similarities, but they've changed the vaccine formulation this year to make it a little stronger against some of the B viruses that we saw last year.
So if somebody is listening and they say, do I want to get it now? Do I want to get it in September? It seems like a flu shot might be better closer to the real cold time of the year. What is your advice from a physician's point of view?
My advice is to start getting the flu shot in early October. We usually have our peaks of flu season in late November when people start gathering together for the holidays. Mm-hmm. So I would advise people to get it at least 3 to 4 weeks before that, which is typically early to mid-October, the latest.
If somebody wanted to get it now, would there be any problem with getting it now? How long does it seem to have an effect to prevent the flu?
The flu vaccine should protect people pretty well through most of the season, so people can get it now.
So what will be the peak flu time?
Peak flu time is usually November, late November through March.
Through March. And are we pretty clear of the flu after March? I think the answer from a doctor that I've heard in the past was you can get flu any time of the year.
Yes, you can. Yes, you can. Depends on where you live. Most of the flus that we see beyond March are in people who travel because again the southern hemisphere has a little different seasonality to the influenza than we do.
Doctor, hold that headphone up to your ear. I've got a phone call here, and if it's a question about the flu, I want you to be able to hear that, and you have to have the headsets to do that. Hi, caller. Did you have a question for the doctor?
I do. If a person wanted to find out what the ingredients were that were contained within a vaccine, how would they go about doing that? As they're not listed on any of the packaging.
Okay, thank you. Keep listening. He's concerned about exactly what makes up a flu vaccine.
So that information is available on the CDC website. If you go to cdc.gov and you type in influenza, they will list what components are in the vaccine. Or you can ask your doctor, and they should be able to provide you with that information.
CDC, which would stand for Centers for Disease Control, cdc.gov/influenza, and it would be able to tell you what that is. The risk are greatest, it seems like, every year for the very young and the very old. Anything change with the advice this year?
No, it's still the very young, the very old, and anybody with chronic diseases like diabetes, heart conditions, high blood pressure. People, again, who are chronically ill should get the vaccine more so than other people.
I also think sometimes people misunderstand what flu actually is. If you have the flu, what would be your symptoms?
It's a cold that makes people feel really bad. So it's a cold that also gives you headaches, muscle aches. You feel miserable. I've met quite a few people who do not really have runny nose or cough congestion, but get the headaches and the severe body aches. That's typically what we see.
So it's like the worst cold you could ever have.
Yes.
How long would it last if you got a case of the flu?
For most people, about a week.
So I don't know. The flu is if you're really healthy, and if somebody says I'm as healthy as I've ever been, have you seen those people come down with the flu?
Yes, and what I tell them is, if you get the flu, you may only have a cold, and you'll get better within a week. But what about your loved one who's an asthmatic? What about your loved one who's a diabetic that you live with? That you can expose them, and they can get sicker. And also, some healthy people get the flu, they get better, but after the fact, they can get pneumonia. So you can still get some bacterial infections that are complications of influenza way after you've had the flu.
If you got the flu shot within the next week or two, a week from today is October 1st, and you suggest maybe early October would be the prime time to get that. That lasts through March?
Yes.
Into next spring. And you just need the one flu shot.
Yes.
And if you don't like needles, you can do the mist this year.
Absolutely.
Anything else, doctor, you want to leave us with?
No, that's all. And people, remember to stay home if you feel like you have influenza, cough in your sleeves, wash your hands. Those things will help prevent spreading it.
Hopefully it'll be a quiet flu season.
We hope so, too.
And people will get their flu vaccinations or their flu mist. Dr. Christelle Ilboudo, it's good to see you again. Thank you for your advice.
Thank you.
It's News Talk 1400 KFRU.